We're going to continue with the examination now. Your visual acuity was normal, which is terrific. But now we need to do a careful examination of the eye and make sure that the ocular health also is normal. The first thing that I'm going to be doing is shining some lights in your pupils. It shouldn't hurt, but it will be bright. I'm going to have you look straight ahead off in the distance, and I'm looking at using a light on one eye and observing the pupillary response, and the other eye and observing the pupillary response. And now I'm going to do a swinging flashlight test, which is moving the light rapidly from one eye to the next. And I'm observing to make sure that the pupil does not dilate as I move the light across. This is a very important sign for ophthalmic disease of either the optic nerve or retinal origin. And it's sometimes called a Marcus gun pupil or a swinging flashlight test. I'd like you to look straight ahead now and focus on one small object, straight ahead off in the distance. I'm going to cover your eye and look to make sure that the eyes are well aligned. And now I'm going to move from one side to the other, and they're in perfect alignment. Now I'm going to look at just the external surface of the eye and the eyelid. Look just straight ahead for me. I'm inspecting the brows. Close your eyes for me. The eyelids open. I'm now going to assess the ocular motility. Look way up high as you can. Good. Look way down at your toes. As I'm assessing motility, I'm also able to inspect the sclera and conjunctiva, which is normal in appearance. Look straight ahead. Look to the right as far as you can, and left as far as you can. Very good. So this has allowed me to look both at motility and at the ocular surface. Now as I look at the cornea, which is the window of the eye, the cornea appears clear. I can look only at gross levels of clarity with a pen light. The fine details are seen only at the slit lamp. I'm going to assess the depth of the anterior chamber by holding the pen light to the side. I'd like you to look straight ahead. And I'm going to bring the pen light perpendicular. And I see that the light goes all the way across the iris and illuminates the iris when held perpendicular to the limbus, which is the junction of the cornea and the sclera. And this tells me that the anterior chamber depth, which is the very front part of the eye, is probably within normal limits. I'd like you to look straight ahead. I'm now going to use the direct ophthalmoscope to look at the retina and the optic nerve. Now this is fairly bright, and I don't like you to move your eyes just to look straight ahead. That'll be easiest for you. I always start at about a foot or two away from your eye on a +3 or 4 lens. That allows me to get a sense of whether or not the cornea and the visual axis is clear. And then as I come towards your eye, I actually wind up resting my hand on your cheek, and I'm as close as possible to your eye with the direct ophthalmoscope and to my eye with the direct ophthalmoscope. That gives me the best view of your retina. So I'll have you look straight ahead, and you'll see you'll see the start of the light. And now I'm touching your face, and I'm actually looking at your optic nerve. Now, when I look at the optic nerve, it fills my view. I've now looked at the superior vascular arcade, the inferior vascular arcade, and if I move the scope temporally, I look directly at your macula, and that's the entire direct ophthalmic examination. I'm going to now flip the upper eyelid to look at the underneath side. Sometimes allergic diseases or foreign bodies can be manifest just on the underside of the upper eyelid and can cause complaints such as irritation or itching. Now when I do this, it'll feel uncomfortable and odd, but it shouldn't be painful. I'm going to have you turn your head gently to the side, and I'm going to have you close your eyelid. You're going to feel my fingers on your eyelashes, and I'm going to put pressure above the level of the tarsal plate, which is about 10 millimeters. If you put pressure at the right location, the eyelid will flip, and then you can assess the status of the palpebral conjunctiva, which is the technical name for the conjunctiva lining the eyelid. And that's it.